Hello everyone, myself HIMANI Sharma from RPIIT campus. In today's class, I discuss about the understanding asthma advances in the management and treatment strategies. Introduction to asthma. Asthma is a chronic respiratory condition affecting the millions worldwide. Understanding its mechanism, trigger, and management is essential for effective treatment. This presentation will explore the recent advances in asthma management and treatment strategies aiming to enhance the patient outcome. What is the asthma? Asthma is characterized by inflammation and narrowing of the airway leading to difficulty in breathing, and symptoms include wheezing, coughing, chest tightness, and shortness of breath. Identifying the underlying causes is crucial for effective management. Asthma trigger. The common triggers include the allergens, respiratory infections, exercise, and environmental factors. Understanding these triggers help the patient avoid them, reducing the frequency of asthma attacks. Effective management often require identifying and mitigating these environmental influences. Diagnosis of asthma. Diagnosis typically involve a medical history, physical examination, and tests such as the spirometry. These assessments help determining the severity of the asthma and guide treatment decisions. Early and accurate diagnosis is essential for effective management. Medication for asthma. Asthma management often include the bronchodilator and anti-inflammatory medications. Short-acting the bronchodilator provide the quick relief, while the long-term control medication help reduce the inflammation. Understanding the role of each medication is vital for effective treatment. Inhaler technique. Proper inhaler technique is critical for effective medication delivery. Patient must be educated on using the inhalers correctly to ensure the optimal drug absorption. Incorrect usage can lead to the inadequate treatment and poor asthma control. Allergy management for patients with allergic asthma. Managing the allergies is crucial. This may involve the allergen avoidance, use of the antihistamines or immunotherapy. Tailoring treatment to individual allergies can significantly improve asthma control. Lifestyle modifications can significantly impact asthma, and the exercise, a healthy diet, avoiding the smoking can improve the lung functions, overall health, the well-being. Encouraging the patient to adopt these modifications is essential for long-term control. Monitoring asthma. Regular monitoring of asthma symptoms and peak flow reading is vital. This helps in recognizing the worsening symptoms early. Adjusting treatment according. The patient should be encouraged to keep a diary of their symptoms and medication use. Recent advances in the treatment. Recent advances in treatment include the biological and the targeted therapies. These there are the treatment focus on the specific pathway involved in asthma, offering the new hope for patients with the severe asthma who do not respond to conventional therapies. Future directions. The future asthma management lies in personalized medicines and an ongoing research. Understanding genetic factors and individual responses to treatment will enhance the management strategies, leading to better outcome for asthma patient. Conclusions. In the conclusion, understanding asthma and its management is essential for improving patient outcome. Advances in the treatment options and personalized approaches will continue to develop, the providing hope for those affected by the chronic conditions. Thank you. Today in class I discuss about the asthma. Thank you for watching.